Hey, good morning, everyone. I'm Josh Breslow coming to you from the WKRN.com alert desk and on our Facebook page. Governor Bill Lee announcing right now that he will end statewide public health orders and end the local authority to issue mask requirements in 89 counties directed by the state health department. He is speaking now, so let's listen in.
My last COVID-19 executive order will expire tomorrow. Remaining actions will be simply to address lingering economic and regulatory issues. Above all else, Tennesseans have embraced the idea of personal responsibility and have allowed us to get in this state from a public health crisis to a managed health issue. For the first time since COVID-19, vaccine has become a reality. It has been made available to everyone who wants it in every single county in this state. Everyone who is over the age of 16 in Tennessee has had access to vaccine for almost a month, many for more weeks than that. Anyone can get a vaccine today, no appointment necessary. I got a vaccine. It's safe. It's the most effective way to manage our health, and more Tennesseans are doing that every day. We've spent the last year putting in place infrastructure that allowed Tennesseans to get tested, to get a vaccine. We have made adjustments in our healthcare system to allow for the flexibility necessary for the ebbs and flows of this public health crisis and this particular virus. After more than a year of public-led health interventions, we're in a different season. It's time to shift our focus now more toward recovery and not restrictions. There are currently no state-mandated restrictions on businesses in 89 counties that the state has jurisdiction over, and there hasn't been for many months. But last year, during the height of the pandemic, we did provide the Tennessee Pledge as a guide to give businesses direction about ways to operate safely. These guidelines will today be officially retired in order to send a clear message that Tennesseans now know how to manage their own day-to-day operations without a government playbook, even if it was a voluntary one. So whether it's capacity limits or temperature checks or other burdens on operation, it's time for businesses to get back to serving their customers. It's time for celebrations and weddings and conventions and concerts and parades and proms and everything in between to happen without limits on gathering sizes or other arbitrary restrictions for those events. And while I never instituted a statewide mask mandate in the state, we should address the remaining mask mandates that are in place at the local level. So effective tomorrow, no local governments in the 89 counties that fall under our jurisdiction will have the authority to issue a mask mandate. With regard to the other big 6 counties whose authority is independent, 3 of these counties have mask mandates and have some level of business restrictions. Each of these counties has been moving in the right direction, and I spoke with each one of these counties over the last day. Our office either reached out or I spoke personally to those mayors about my desire that by Memorial Day, all business restrictions, all mandates, mask mandates and limits would be lifted across the state. We believe that'll happen. Mayor Cooper has I believe will be announcing today a lifting of restrictions in our city. We talked about his desire to lift a mask mandate at the appropriate time, so we think that will be happening in cities across our state. It's an opportunity for our state to truly be fully in every way unrestricted throughout our state. COVID-19 is part of public health, and it's here to stay for the foreseeable future. But we have to learn to live with it just like we do any risk. And when there is an emergency or crisis, government should respond. And when that crisis diminishes, government should respond again and snap back, and now is the time for that. This is about trusting Tennesseans, using the tools that we have at our disposal to get out of the way and out of the business of crisis management and back to the business of life. Tennessee is moving forward thanks to her people. I will be happy to answer any questions that you might have. Jonathan.
Governor, as you're moving to sort of eliminate, I guess does this eliminate the state of emergency as well, first of all?
Actually, the state of emergency stays in place for purposes of deregulatory issues that are still necessary from a healthcare standpoint and from federal funding standpoint that necessitates that state of emergency. It's a limited state of emergency.
In rural areas, and as Dr. Pierce said, some rural conservatives have been very hesitant to get the vaccine. What do you have in mind to try to convince those folks to get on board? Because if people aren't getting vaccinated out there, it's right to still be happening and would be happening at a potentially greater level if the priorities shifted.
So what's most important is that we give Tennesseans the opportunity and the access to do that. Our Department of Health is working very hard to provide mobile clinics, to increase opportunities and places that folks can get vaccine, particularly in our rural communities. Well, actually in every community. So we're targeting populations that have low uptake and continuing to see people get vaccinated, but continuing to push for Tennesseans to consider that in every part of the state.
Commissioner Piercy has said a couple months ago that you all were going to be doing some kind of marketing campaign to encourage Tennesseans to get the vaccine, much like you did with the announcement. What's the latest on that? When do you expect that?
Yeah, we've discussed that in our Unified Command Group meetings, and there's a clear path for that over the next several months. It will be starting soon. I don't have the exact date of that, but there's been that campaign is being developed right now in a desire to get it rolling soon, but I don't know the dates of that. We can talk to Department of Health and confirm that. Gerald?
We talked about rural Tennessee, but also we have some vaccine hesitancy among African Americans in the community of color. As my colleague said, this market campaign has been in the works for a while, but we're still not seeing anything measurable. What can we expect that? Because you say that the vaccine is part of the way that we help people.
Yeah. So again, I don't know the exact date of the rollout, but we are developing a marketing plan. And in fact, the federal government is as well, and I've been in contact with Jeff Zients and the White House Coronavirus Task Force to talk about the particulars of how we message effectively, and my admonition to them about messaging in different states in different ways. So this is all part of what we'll be doing in the future. But you also talked about hesitancy among African Americans, and our Office of Minority Health and Disparities Elimination continues to provide research, opportunity, communication to provide access in a greater way to minority communities and ethnic communities across the state. I'm very proud of the work that they're doing and their continued effort to make sure that that population, like all of our population, understands how important it is that folks get vaccinated so we can move forward. Yes, sir. Yeah, I don't think we should be mandating vaccines that have only been approved as an emergency authorization. And I generally don't think mandating vaccines is a good idea in the first place. And I've said pretty clearly I don't want vaccine mandates, vaccine passports. This needs to be a personal choice for people, and we should keep it that way. Do you have a question?
Yeah, thank you for asking. In Memphis, you said that you support the bill to require teachers to warn parents if LGBT community was mentioned. Would you support something like that that required Jews to be mentioned or Black people to be mentioned? Do you see the moral issue there?
What I see is that parents should have the last word about what their children learn in our public schools. Parents should decide, not the government, what their individual children should learn. And it's a parental choice educational bill, and that's the reason I'm supporting it. Yes?
Hi, Governor. So, you just said, the government has no business in, the issue of public health. But, similarly, there's a bill that's currently gaining momentum, and it's currently waiting for a House vote. It would basically prohibit gender-affirming hormone treatments for minors. So I was wondering if you would like to support that bill, follow this philosophy.
Yeah, so that bill, like a lot of bills, as you say, hasn't passed yet. And as you know, the process is that these bills are amended, they change, they get through committee or not. And I don't read all the language of all 3,200 bills until they're actually closer to my desk. And I can comment on that when it's passed and is closer to my desk.
So far, you have supported, a series of bills that, advocates would say are having transgender children. This is one of the bills that you're focused on. And it is very close to your desk. I mean, all of these is a House bill. So I was wondering if you could apply the same philosophy that the government has in a role in public health when it comes to this.
Yeah, so every bill's different, and I would apply the philosophy to each bill when I have an opportunity to read that particular bill in its final form and it's passed through committees, and we're not there yet with that. Yes, sir.
Governor, two questions. The first one has to do with the EBT cards and the rollouts. I've heard some complaints from audience about people not receiving them yet. What's being done to make sure that's a smooth process?
Yeah, so first of all, it's really important that that process work, and because these cards are the opportunity for low-income children to access food. It's very important that we get that process right. I actually met with Commissioner Carter 2 days ago. We talked in particular about this process and how it is that we can streamline it, make it better, make sure that kids get them. We have taken a number of different approaches to make sure kids get them, also eliminate fraud, make sure we don't send cards out to addresses that no longer are applicable. The primary strategy is to utilize schools, and we are working with our schools. We are advocating to our schools. We are encouraging our school districts to engage. Some of them have been incredible partners. Some have been slow to adapt. But if our school districts will partner with us in identifying the location of these kids and a strategy for getting those cards to them, then we believe that'll be the best way forward. But we see it as a priority, and we're working on it.
The second question is, you spoke personally with Mayor Cooper. I took it from your tone.
Right.
You guys haven't always seen eye to eye when it comes to this pandemic or the school system, and I know you've had some choice words in the past. I take it things are a little smoother now between you and Mayor Cooper?
Mayor Cooper and I talk on a regular basis about a number of issues. We've done recruitment trips together for ECD. We talk about issues, and that's right, we don't always agree, but certainly we understand that just because you don't agree with someone doesn't mean you can't work together. That's a principle that I think is somewhat been lost in our country, but I hope it's not lost in Tennessee, and it's certainly not in my relationship with and working together with our municipal mayors.
Governor, early on in this pandemic, you spent several $1 million of state resources on advertising to encourage people to wear masks. Why haven't you acted quite as quickly in terms of messaging about shots and spending money?
Yeah, I think I've been asked about that twice, and the answer is that we are developing a serious campaign to encourage people to get vaccine, and I don't know the particular date that we roll that out. But it's very important to us.
Before, you were so quick before on the mask mandates. Why, this is weeks and weeks?
Yeah, because right now is when the hesitancy wane begins the most, and it's the most important time to begin to remind folks that getting a vaccine really matters. And now that everyone has access all across the state and everyone's had an opportunity, now you start reaching out to the people who have been hesitant.
And when, if I can ask, when did you get your second shot, and why not make a public display of that in order to to put some of to reassure some of these people that these are safe medications.
Yeah, I got my second shot last Saturday or Friday, 10 days ago, maybe. That's right.
Why so quiet about it?
It's a public decision, personal, private health decision, and that's what I did, and that's how I made it.
But you're the governor of the state.
That's right. And it's a personal, private decision, and that's how I did it. Yes, sir. Kyle.
You may have said something about this, but you talked to Mayor Cooper about the mask mandates and what you're trying to do here with local control. What did you say about that? Sorry, we're having some camera trouble.
He and I talked about what I wanted to happen across the state, what I was going to announce. I wanted to let him know what I'd be talking about. He indicated to me that he felt the same way about lifting restrictions, that he would be making announcements soon, which he did, or which he is going to apparently in the next several hours. He also indicated that he wanted to lift a mask mandate at the right time, and so I'm expecting he'll do that as well in his timing. I told him I was hopeful that all of these would be done by the end of May.
And similar conversations with the mayors of the other major towns?
That's right. That's exactly right. Similar conversations with mayors in other towns. Okay. I spoke personally to the Shelby County mayor. My office reached out to the other 4 county mayors.
Okay, a question on a different topic now. The unemployment bills that are going through
the what bills? I'm sorry.
Unemployment bills that would reduce the amount of time. Do you support those?
You know, again, I want to look at the final language, but here's what I think about unemployment. We have, I think, 275,000 open jobs in this state, and we have 150,000, 160,000 people on unemployment. We need to do something to move people from unemployment to employment. We need to encourage and incentivize a movement in the right direction. I think this bill does that. It provides more unemployment for a shorter period of time, which would help folks, but encourage them to pursue one of those 250,000 jobs that are open across the state. Again, I think the final language of that bill is not fully determined, but in concept, I do support it. Yes.
There's one more question just in regards to that. There's a lot of people who work on traveling music tours here in Nashville, and I think a lot of the jobs that are out there don't really play to their strengths. What do you have to say to some of the people like that that just don't basically their career end? Yeah,
I mean, we've got to work. We've got to. This is generalizations, right? So we have hundreds of thousands of jobs out there. We just need to figure out a way to appropriately connect the ones. And unemployment is there for those who need it, but we just need to make sure that that system works to benefit folks in moving them into employment. And I think most folks would rather be in employment than they would in unemployment, but we need to incentivize that. Sam?
Yeah, there have been some bills this year, relating to the judiciary, the bill that would have removed Ellen Knox allow. Now the House and Senate have approved a statewide chancery-type court, and the House last night passed a bill that would basically allow every constitutional question to take effect, regardless of what the chancellor here in Davidson County says, until it gets to the Supreme Court. Do you sense a move here to kill an independent judiciary, and do you support that type of move?
I think what is of concern across the country and including in Tennessee are activist judges who actually are trying to legislate from the bench. And I think that's the move that we're seeing here, is a desire to, in fact, have a independent judiciary that is not an activist judiciary. I think that would be my characterization of what's happening with these bills. So I'm not sure which ones are going to get through, but that's what's happening.
So do you feel like the judges or the chancellors who made those decisions were legislating from the bench?
Well, you'd have to ask me about specific decisions and specific judges. You asked me about specifically what I thought why these bills are being passed in response to what. That's what I think they're in response to. I don't, which decision? She makes decisions all the time. I answered your question about broadly where we were going, and I think that's what's happening. Stephen, you have a question?
This is the last question, by the way, if you have time. Stephen?
Yeah, you said you want to pivot the state's role from responding to the disease to responding to the economic fallout. What will or does that look like?
So, could you repeat the question?
Yeah, you said you wanted to pivot the state's role from responding to the disease to responding to the economic situation. What does that look like?
So we want to respond to the virus. We just need to do so as a managed health situation through the Department of Health. COVID-19 is here, and it will be with us, and so we will respond to it from a public health standpoint. We want to continue to do that. We just won't respond to it as if it were a public health crisis. And one of the ways you do that is by lifting all restrictions on businesses so that they can operate fully, and that the economy can be fully recharged and restarted. That's a response to economics instead of a response to a public health crisis. But we also are utilizing our economic recovery group to work with businesses across the state and business groups across the state to see how it is that we can strengthen our economy, working with the businesses in Nashville, the industries in Nashville, the bureaus in Nashville that work with conventions to determine ways that we can incentivize, whether it's through advertising, Department of Tourism, economic and community development, how we can focus on economic recovery in our state and shift our focus away from health crisis and let it simply be a health management issue. Thank you all very much. Reviewed, and they too are in that same process of not sure what final. Generally speaking, I've been opposed to medical care.
All right, so that wraps up the news conference with Governor Bill Lee there. He did announce he will end the statewide public health orders effective tomorrow, ending the local authority of mayors to issue those mask mandates in the 89 counties that are run by the state of Tennessee. He has also asked the 6 other counties that have their own independent health departments, that would include Nashville and Davidson County, to end requirements by the end of May. That would include those mask mandates.